My name is Kate Karalunas, and I am a registered dental hygienist with over 10 years of experience and advanced degrees in dental hygiene and clinical health science. Today I'm going to be talking to you about the proper dental hygiene routine and what we can do at home to better take care of our teeth. One of the main things we can talk about first and foremost is the frequency in which we brush, and anything that we're going to talk about today should be performed at least once daily. Some of the objectives are going to be recognize why it's important to have good oral hygiene, to be able to identify the steps, methods, and techniques necessary in order to properly perform these dental hygiene techniques and mastery of the skills, and then identify the products in which we use. So good oral hygiene habits are essential to have starting at a young age. When we have good oral hygiene at a young age, we have increased amounts of academic success directly linked to time out of school and ability to focus due to a lack of oral pain. Our oral hygiene also has the ability to manipulate our immune response in a way that can impact our body's systemic response to other diseases or how our body actually is able to control them. Things like diabetes and periodontal disease, which is an oral condition, are directly related, and the ability to control one directly impacts the ability to control another. We want to try and keep our teeth as long as possible. Having good oral hygiene is going to increase the lifespan of our teeth and therefore increase our quality of life. And of course, having a bright white smile or a clean, healthy mouth is going to improve the confidence of the person. So our teeth impact our overall health, and this is mainly caused by bacteria. So our bacteria in our mouths directly manipulate how our body's immune response works, and that confusion of the immune response can control which things our body decides to fight off. So the first step we can do in order to control this oral bacteria is proper brushing. There are many formal brushing techniques that vary based off the person's age and dexterity and skill set, dental IQ. All those things play a role in your recommended technique. And talking to your dental provider is the best way to get the technique that will be most pertinent to you. So it's going to vary off of person to person, but the most universal, the kind of standard is going to be what we call the modified Bass technique. And not this type of talking modified Bass, but it's actually a toothbrushing technique that involves placing a small amount of toothpaste onto our toothbrush, angling the toothbrush at the 45-degree angle to the gum line, wiggling it back and forth, and then sweeping up the long axis of the tooth to where our biting surfaces are. And you're going to do that 2 to 3 teeth at a time around the entire mouth. You know the average person only brushes for 36 seconds. I'm going to pop back up in 2 minutes, which is the recommended time that you should be brushing. And then once you've done that modified Bass technique, you're just going to kind of do a scrub brushing method on the biting surfaces alone, carefully missing the gingiva or the gum tissue while you're brushing. The next step is going to be the C-wrap flossing technique. And in order to do that, you're going to want to take a long length of floss, about 4 arms length, 12 inches, and you're going to wrap it around your middle fingers. By wrapping it around your middle fingers, you're going to increase your dexterity and mobility with your ring fingers. So you're going to use your index fingers to kind of manipulate the floss and seesaw it in between the teeth or the interproximal space. And then you're going to manipulate the floss in a way that it hugs both teeth, making a C shape, similar to what we see happening in the image on the right. You're going to do this every tooth in the mouth, The last thing we're going to talk about is mouth rinse. So therapeutic mouth rinses and cosmetic mouth rinses are the 2 main classifications. So a therapeutic mouth rinse is something that has what we call substantivity. It's available over the counter or by prescription, and it's going to have things like tartar control, anti-cavity, bactericidal, those types of things. And the frequency in which you use these is going to depend on the product in which you're using. So something like a prescription fluoridated toothpaste or mouth rinse might be a once a day thing versus something like a Listerine over the counter or something that you can use twice a day. So it's going to vary based off of your needs and desires. It's been 2 minutes. A cosmetic mouth rinse is something that has very minor substantivity or lasting effect, and after you spit it out, it really doesn't do much besides just freshen your breath. So it's going to be more of a flavoring agent, a freshener, maybe have a little bit of a whitening effect, but it's not going to have these antibacterial products that we see in our more therapeutic mouth rinses. So the big three, when we're talking about our home care routine, is going to be brush, floss, rinse. So brush for at least 2 minutes twice a day. Next is going to be flossing. Flossing is recommended once a day at least. It takes about 24 hours for that bacterial biofilm to become pathogenic enough to cause disease. So you want to try and brush at least once a day to minimize that bacterial growth that you have underneath your gum line and in between your teeth. And then like we said with mouth rinse, the use is going to depend on what one you're using and what your desired outcome is going to be. So you should talk to your dental provider or your dental hygienist about what is best for you. The most essential part of time of day to do your dental hygiene routine is going to be at night. Thank you. Time's up. It's been 2 minutes.